Hi there, Dr. Scott Martin here, and today we're going to talk about how 176 million women can't be wrong. Yes, endometriosis is a big problem and can go completely undiagnosed in young women. Unfortunately, some doctors don't think that teenage girls are old enough to have endometriosis, meaning it goes undiagnosed, resulting in surgery and at times removal of some of the reproductive organs. So let's talk about endometriosis so it's easier to understand. Endometriosis is the abnormal growth or abnormal function of the endometrial lining. You already have endometrial tissue in your uterus, and what it does is create a layer of blood in your uterus, which essentially becomes the soil for your fertilized egg to implant into. When the normal build-up and breakdown of the endometrium stops, it creates a dysfunction of these cells and prevents it from breaking down properly. Now, if the endometrial lining doesn't break down properly, it leaves old blood there. A bit like when you're cooking and you have the burnt bits that get stuck to the sides or the bottom of the pot. Endometriosis is much like that. Another aspect of endometriosis is that it starts creating endometrial tissue outside of the uterus. What happens is you start growing endometrial cells that excretes endometrium like it would in the uterus, except it's around the other areas of the reproductive organs and doesn't get washed away by the menstrual flow the same way it does in the uterus. It can build up slowly, period by period, over many years, to such great amounts that it accumulates in old stuck blood throughout the region, like blood clots or scabs. It can adhere to your ovaries, fallopian tubes, the outside of your uterus, and even your intestines, and stick them all together like glue. This extreme kind of endometriosis often ends up in surgery with the loss of these particular organs if they can't be separated. When we look at surgery for endometriosis, doctors will perform a laparoscopy to confirm the diagnosis and then scar over the endometrial tissue with a laser so that the tissue stops producing endometrium where it's not supposed to. The operation seems to work, but the results only last about 6 months, with an average 25% remission rate at that time. So we see 1 in 3 young women with chronic pelvic pain have a 50 to 70% chance of it turning into endometriosis. And after surgery, 25% of them will have it back in 6 months' time, and that final number is 176 million women worldwide today. But what we're missing here is that still 1 in 3 women will end up with a hysterectomy, regardless of the short-term results of drugs or pharmaceuticals or surgeries throughout their lives. Is there a better way? Can we reduce these numbers? Find out in the next video. Thanks very much for watching and have a great day.